sexually transmitted infections, or STIs, are on the rise, and syphilis is one STI that strikes back, even affecting newborns. Approximately 40% of babies born to women with untreated syphilis can be stillborn or die from the infection as a newborn. Joining us to discuss is Micah Madir, the Prevention and Outreach Specialist with Empath Partners in Care, also known as EPIC. Welcome to Bloom.
Thank you for having me here today. I appreciate it.
Well, this is a very important subject, something that everyone needs to know about, especially with news reports saying that, STIs are on the rise. But let's talk specifically about syphilis. How easily can that spread? So
syphilis is something that can spread very easily. It all depends on the contact. So it's usually sexual contact, sexually transmitted infections. Once somebody has contact with the genital areas, most likely syphilis will be, spread. What happens is they create canker sores, and that's how we spot it, and that's how we know that syphilis is in the affected area.
So how does it affect newborns? Is there a cure for babies if they are in fact infected?
So what we ask for newborns is really, it's on the mother at the very beginning. Prenatal care is very important. We all know this, but it's hard for mothers to get prenatal care. Once the baby is born to a mother who has untreated syphilis, what we then want to make sure is that they're getting the right treatment right away. Penicillin is the most common way we fight syphilis these days. If somebody's allergic to it, that's why we want to get them checked out right away. It's because we want to find the best treatment option for them. So it really depends on what that person is allergic to, but most likely we're going to use penicillin.
So how long can you live with syphilis untreated? I mean, does it have a spiraling effect?
So, we never want to tell somebody how long can you live with a virus or a disease. But we say about 10 to 20 years. Within that time period, your body starts deteriorating. So it could cause blindness, internal organ problems, kidney failure, liver failure. So it's something that we don't encourage, obviously, for somebody to go this long untreated. But the timetable is about 10 to 20 years before we actually see rapid decay of the human body.
So are there symptoms that people can look out for, or could you have syphilis and not even know it?
Yes, very much so. And that's with all STDs and STIs. We always want to make sure people are getting checked and tested at all times regularly. With COVID, we hear the term asymptomatic all the time. So the same thing with these STDs and STIs. You could be asymptomatic, and not know you have it. So what some of the warning signs are, like I said, you see some of the canker sores around the genital areas. That's what we know about syphilis.
So you talked a lot about prenatal care, and it's been 13 plus years since I had my last baby, but I do remember, it was important before each birth that they checked for any kind of, STIs. But like you say, not all women are getting the care that they need, especially now due to COVID.
Yes. So at EPIC, we have a new program called TAPWA, which helps women who are at high risk be able to go ahead and get treatment, find that prenatal care. It's like a referral service. We're able to locate that for other people. But at the same time, if a woman is not going into the doctor regularly to get those checkups, say she's not pregnant, so she's not going to prenatal care checks, so she's not getting those tests, it's important that you get tested every 3 months. That's for the whole panel. So not just syphilis, but HIV, gonorrhea, anything in between. You just want to make sure you're tested. Getting tested regularly is the best way to combat that.
How do these tests work? Are they blood screenings?
Yeah, it's a finger stick, most of them, or oral swab. Painless. I like to do the little trick. 1, 2, 3. You go on number 2. They never expect it. But it's virtually painless. We take a little bit of blood, we put it into the vial. It's like a litmus paper, and once it goes through, we'll be able to know the results. Nowadays, most of the time, about anywhere between 2 to 20 minutes.
Really? So you can get your results right there on the spot?
Oh, yeah. So at all of our EPIC locations, we do testing, especially HIV. That's what we pride ourselves in. Our HIV testing, the whole process, 15 minutes max.
That's really fascinating. All right. So what do you recommend people do if they have been exposed to syphilis? I mean, obviously, the earlier you know, the better.
Yes. Like I said, being tested regularly is one of those things to prepare yourself. Make sure that you know your status and know your partner's status. Once you think that you have become in contact with any STD or STI, make sure that you're going to your doctor right away. If you don't feel comfortable going to your doctor's office, Once again, at Epic, we have our locations there. We have trained specialists who can talk to you about everything that's going on and be able to guide you through the process and the next steps.
Well, thank you so much for joining us on Bloom. This is a really timely discussion right now because we're hearing about this more and more.
No, thank you for having me here, and I'm happy to spread any type of information I can.
All right, thank you so much. And for more information, you can visit myepic.org, and we'll be back with more Bloom right after this. Stick around.